what their specific diet order is. You also want to check to make sure there's no sign that says NPO. If it does say NPO, then not to have anything by mouth. Okay. You also want to check any specific cardiac diet, renal diet, diabetic diets to make sure that it's appropriate. And when you're feeding your patients or assisting with feeding, you want to check to make sure that there's no history of possible stroke, there's no dysphagia. Do they need to have SLP, which is speech language pathologists come in and do a swallowing assessment for your patient? And then Christy can talk a little bit more about feeding your patient.
So your patient gets, this is a general tray. Here is your patient's side table. You can bring the side table up and down with a little valve here. I'm going to put it underneath the patient's bed. I also want to make sure that the patient's in a nice high position. You don't want them laying back or because it's a hazard for choking. So I'm going to get this patient up into a 90-degree angle, or as high as this bed will go. If your patient has had a stroke, you want to make sure that you're feeding on the appropriate side so the patient's able to swallow. You want to make sure that your patient isn't on any dysphagic diets and you're giving them food like this if they are at risk for aspiration. You don't want to be putting anything into a patient's mouth that's totally confused. Also, you can always just set up your patient like this, or if your patient needs encouragement, you can feed them as well. So making sure the patient's up high, maybe getting them a bib or something so that you don't spill on them, and then encouraging them to eat.
Mm-hmm. And you want to try to promote independence as much as you can for your patients. You don't want to always feed them and get them kind of used to that. Make sure you promote independence. You can certainly open up packages for your patient because it might be hard to open up the milk or the juice. But in terms of getting them to eat themselves, you should be helping set up and you should be encouraging your patients to use the utensils to start feeding themselves. Just make sure once the patient starts coughing and choking, you want to make sure that you stop feeding the patient immediately, remove the tray, get rid of all the food and the liquids, and then make sure you have your suction ready because you might potentially be needing to suction their oral cavity.
And then just getting SLP, speech and language pathology, maybe in to reassess your patient. Maybe they need a thicker minced diet and not just something general like this.
Yeah, and also noting how much they've eaten, you know. Some patients will just have a few bites. That's not enough caloric intake for their nutrition, right? So trying to encourage them to have more calorie intake, especially if they have big wounds and things like that too. And so noting if they've eaten 50%, 85%, or 100% of their tray.
Because you're definitely going to have to be documenting this on your